life should be. Fun for everyone. Life is easy if you wear a smile. Just be yourself, don't ever change your style. You are you, I am me, we'll be free. Hello world, this is me. Life should be, yeah, fun for everyone. Hello world, come and see.
Hello everyone, it's a real pleasure to know that you're more and more interested in this English immersion program. Today, we're going to lead you to the USA Embassy for an English immersion program on Ebola with Mr. Travis Murphy. But before that, we invite you to follow his introduction.
Welcome to the United States Embassy for this month's English immersion. We're very happy to have you all here. How is everyone? Good, that's good. It's good energy. I like that. That's great. Well, as we've done in the past, we're going to listen to a story from Voice of America, and then we will go over the text. First, we're going to listen to it. Everybody will just listen and see what they can pick up. Then we're going to distribute the script with all the words. We'll go through it again. You can listen to it. And then we'll kind of talk about the vocabulary, see what questions you have, and then from there we can discuss the issue. Does that sound good? Yes. Okay, very good.
Thank you, Mr. Travis Murphy. As he said, the audio you're going to listen is a story from the Voice of America. Let's listen.
A top health expert warns that the whole world needs to help deal with what he calls the first Ebola epidemic the world has known. Tom Frieden, director of the U.S. Centers for Disease Control, spoke to reporters at the CDC headquarters in Atlanta, Georgia. He warns that the Ebola spread in West Africa will expand greatly over the next few weeks. He says a massive global effort is needed now to contain the disease. Dr. Frieden just returned from a visit to the most affected countries: Sierra Leone, Guinea, and Liberia. He says Ebola cases continue to increase quickly, even though healthcare workers are working extremely hard against the spread. Dr. Frieden says the number of Ebola cases is now more than 3,000. He adds that this number is expected to rise quickly in coming weeks. He warns that there is a window of opportunity to stop Ebola, but he adds that window is closing.
There is a window of opportunity to tamp this down, but that window is closing. We need action now to scale up the response.
The CDC chief says the Ebola virus is spreading in two ways: from patients to caregivers and through unsafe treatment of the dead.
It's spreading from just two routes: people caring for other people in hospitals or homes, and unsafe burial practices where people may come in contact with body fluids of someone who's died from Ebola. That is really the Achilles heel of this virus. We know how it spreads. We know how to stop it from spreading. The challenge is to do that everywhere that's needed.
Before leaving for Europe, President Obama videotaped a message for the people of West Africa.
On behalf of the American people, I want you to know that our prayers are with those of you who have lost loved ones during this terrible outbreak of Ebola.
Mr. Obama says he hopes to clear some of the misunderstanding about the spread of Ebola. He says infection only comes through contact with an infected person or the body fluids of someone who has died of Ebola.
That's why the disease is continuing to spread where patients are being cared for at home or during burials when families and friends lay their loved ones to rest.
He says people can respect their traditions and honor the dead without risking the lives of the living. Dr. Frieden warns that each day's delay in dealing with the Ebola spread makes it more difficult to stop. The CDC director says resources, technical experts, and a worldwide organized and unified plan are needed. He says Ebola is not only an African problem, but a world problem. The president of the medical aid group Doctors Without Borders made similar comments at the United Nations. Joanne Liu said the world is losing the battle to contain Ebola. She spoke about the increasing chaos of the situation.
Riots are breaking out. Isolation centers are overwhelmed. Health workers on the front lines are becoming infected and are dying in shocking numbers. Others have fled in fear, leaving people without care for even the most common illnesses. Entire health systems have crumbled.
Ms. Liu said the centers have become places where people go to die alone. U.S. health officials have announced an agreement with a California-based drug maker, MAP Biopharmaceuticals. The deal calls for the company to speed development of the experimental Ebola medicine, ZMapp. ZMapp has not been tested on humans, but 2 American medical missionaries who got Ebola were treated with the drug and recovered. One of them, Dr. Kent Brantley, told NBC television he did not know he would survive.
I don't think they ever said, Kent, I think you're about to die, but I felt like I was about to die. And I said to the nurse who was taking care of me, I'm sick, I have no reserve, and I don't know how long I can keep this up.
Mr. Brantley was released from Emory University Hospital in Atlanta. He said he is in tearful prayer for yet another American doctor who has been infected with Ebola while working in Liberia. The doctor of obstetrics, or childbirth, has separated himself from other people since the signs of the disease appeared. All 3 Americans work for the North Carolina-based Christian aid group SIM International. And that's the Health Report. I'm Ana Mateo.
That was the health report by Ana Mateo. We now invite you to listen to the participants for the questions.
What does CDC mean? What does it stand for?
Okay, that's the government ministry. But then there's also an organization that actually focuses on healthcare research and helps to equip hospitals with the information that they need to fight disease. And that's what the Centers for Disease Control is. But it doesn't just apply in the U.S. It studies diseases from all over the world. Diseases that are currently in existence, like Ebola, and then diseases that have been controlled and only exist in a laboratory. Because there's diseases that have been eradicated, like smallpox is a disease that was really common once upon a time. But it's been eradicated, which means it no longer exists. But they still have the virus in a laboratory. And so the Centers for Disease Control, the CDC, is who studies that to try and learn for treating future diseases. Okay? Other questions on words?
I would like to know the meaning of this word biopharmaceutical.
So this is a company that produces medication. And so they're working on a vaccine. But it's important to note, because a lot of people have this idea that only Americans have a vaccine and they're not giving it to other people. Have you heard this? Yeah? But that's not actually the case. There is no vaccine for Ebola. And so they're working now They're putting millions of dollars into research, these pharmaceutical companies, in order to try and develop a vaccine so that we can give it to people and they'll know they won't be able to contract Ebola, or we give it to them and it helps to cure them. Okay?
I would say something. When she said the has not been tested on human, and again, the second paragraph, she said again, missionary who got Ebola were treated with a drug and a conversion of
Okay. So
it wasn't tested by human, and again, teammate has been treated in another person.
Probably what they're referring to. So ZMapp is a drug, and there were only seven shots, 7 vaccines of it. And these people that were treated in the US, they received some of it. Okay? So 7 people received it, and then that was all there was, because it was an experimental drug, which means it's still being tested. And so I think maybe what they mean is that they haven't done long-term clinical studies, which is to say that they have a drug and they've tested it long-term to see what the side effects are, if it works on everyone but only certain people, or if it doesn't work and it only worked on a couple of cases. So I think maybe that's why they mean.
Just want to make my mind clear about the passage. When they say that there is a window of opportunity to turn this down, but the window is closing. My mind is not so clear about this part.
Okay.
Because when they say the window is, there is a window of opportunity to stand this down, and after they say also, but the window is closing.
Right.
I don't.
Okay. So a window of opportunity. It says on the back here, words in this story. That's an idiomatic expression, right? That means a favorable time for doing something that must be done immediately if it is not to be missed, right? So a window of opportunity means right now the time exists, that right now is the time to do something. But so what's a window, right? Like this is a window, right? So if the window's open, but it's slowly closing, and you want to get something from that window, you have to do it before it closes on your hand, right? So that window is closing, and so it's a figure of speech, it's idiomatic. So they're saying the window is closing, that time is running out, right? And so in this context here, there's a window of opportunity to stop Ebola, because Ebola is spreading. But if we don't do anything about it, that window could close, and it just goes everywhere. But we're doing that. We're taking the steps. The United States, international partners are working with countries like Côte d'Ivoire, who don't yet have the disease, and then also working with Liberia, Guinea, Sierra Leone to fight the disease. And we also have 2 countries, Senegal and Nigeria, who had the disease, and now they're completely disease-free. No one has the disease. It doesn't exist anymore, right? So that window of opportunity is what we still have to keep the window open so we have time to fight this disease, okay?
Well, everybody, we're at the end of today's English program on containing Ebola. Don't be discouraged. It's just the former parts. There's a window of opportunity to show you the latter parts.
Yeah, and thanks to all the participants, and also big thanks to Mr. Travis Murphy for this invitation. See you next week for the latter parts. Bye.
Bye.